Senator Utazi. I represent the good people of Enugu North Central District of Enugu State. I come with to lead the debate for a bill to repeal the Quarantine Act, Cap Q2 laws of the Federation of Nigeria 2004, and enact the Nigerian Public Health Emergency Act to make provisions for regulating and preventing the introduction into and spread in Nigeria of dangerous infectious diseases and further related matters 2021 for second reading. Mr. President, the distinguished colleagues, thank you for the opportunity to lead debate on the general principle of the Public Health Emergency Bill 2021. This bill was read the first time on 5th day of May 2020. The bill was also informed by the challenges that confronted and still confronted the nation regarding the coordination of national response measures to combat the dreaded coronavirus crisis as a result of extant archaic quarantine legislation, which compelled the executive branch to embark on a litany of subsidiary legislations to deal with certain exigencies. Accordingly, this bill primarily seeks to repeal the Quarantine Act, Cap Q2, laws of the Federation of Nigeria 2004, and establish an updated comprehensive legal administrative framework for handling outbreaks of infectious diseases and contagious diseases that portends major threats to public health safety within Nigeria or are likely to be transmitted into Nigeria or outside Nigerian borders if no quarantine or other emergency health measures are not taken by appropriate authorities to control the spread of infection rates. Background and justification. There is no saying that the Extant Quarantine Act Cap Q2 laws of the Federation of Nigeria, which was enacted in 1926, is deficient for the purposes of enforcing quarantine and self-isolation of infected persons at or during the outbreak of dangerous contagious diseases, epidemics, or pandemics in the country. Indeed, most of the ailments like cholera, plague, yellow fever, smallpox, and typhus that warranted the enactment of the Quarantine Act of 1926 do not require the same quarantine measures as today's complex and deadly epidemics such as Ebola and COVID-19. The passage of this bill will effectively address these shortcomings and put in place a legislation that is up to date with modern realities regarding the disease, epidemics, or pandemics. To this end, this bill repeals the archaic Quarantine Act of 1926 and under Schedules 1 and 2 expands the scope and...
Point of order, Deputy Chief.
Mr. President, distinguished colleagues, Aliu Sabi of the line. I come under Order 5610.
You may read.
Order 5610 talks about senators to be silent or shall confer only in undertones. Mr. President, the chamber has become suddenly too noisy.
Effectively address the shortcomings and put in place a legislation that is up to date with modern realities regarding disease epidemics or pandemics. To this end, this bill repeals the archaic Quarantine Act of 1926 and under Schedules 1 and 2 expand the scope and interpretation of dangerous infectious diseases beyond what is contained in the Quarantine Act, structure and the principles of the bill. The bill is made up of 72 clauses, which is subdivided into 8 parts. Major highlights of the bill include Part 2, which deals with important aspects of the bill, such as power of the President and, in appropriate circumstances, the governor of a state to declare any place as an infected area at the outbreak of dangerous disease, dangerous epidemics or pandemics. Appointment of special task force for the effective coordination of national remedial measures at the outbreak of dangerous infectious diseases. The sources of funding of the activities of the task force and other expenditure requirements during such public health emergencies are also articulated in Clause 5, Part 2 of the bill. Part 3 of the bill deals with the administration of the bill, which is mainly vested in a presidential task force to be composed by the President upon the declaration of a public health emergency pursuant to clauses 3 and 4 of the bill. However, the task force may, in accordance with the provisions of clause 6.3 of the bill, delegate the functions or any part of function conferred upon it to the National Center for Disease Control and its health officers. Part 4 provides for the control of infectious diseases within the Federal Republic of Nigeria. Clause 10, Part 4 of the bill also provides for public health surveillance to track trends, prevalence, and patterns of disease outbreak in the country during a public health emergency period caused by sudden outbreak of dangerous infectious diseases. Part 5 of the bill deals with the prevention of international spread of infectious diseases, where the President has reason to believe that a dangerous infectious disease may be introduced into Nigeria through international contacts borne by various modes of transportation, while Part 6 of the bill provides for the enforcement measures by investing certain powers on the National Center for Disease Control in dealing with outbreaks and suspected outbreaks of infectious diseases. This is without prejudice to the powers of the NCDC under its Enabling Act. Part 7 gives certain rights to users of healthcare facilities or those in quarantine. These rights include right to privacy and confidentiality of their medical records, except under permissible situation under the bill, the 1999 Constitution of the Federal Republic of Nigeria, as amended or any act of the National Assembly. Part 8 contains miscellaneous provisions such as modalities for service of notices, etc., default in compliance, general offenses, and exemptions. By and large, this bill simply wants to protect the general populace from the debilitating impacts of the outbreak, of dangerous disease, infectious diseases. Conclusion. Mr. President, distinguished colleagues, this bill could not have come at a better time than now that we are managing one of the deadliest pandemics in the history of mankind, this COVID-19. In compliance with Order 77.3 of the Senate Standing Orders 2015 as amended, I wish to say that the proposed bill has no immediate financial burden on the treasurer of the federal government. If passed into law, as administration of this bill is vested in a presidential task force upon the declaration of a public health emergency, or where delegated to the NCDC, which is an existing agency of the federal government. The sources of funding the activities of the presidential task force, as contained under clause 5 of the bill, are only needed where a public health emergency is declared by the president under this bill. In view of the foregoing and considering the relevance of this bill, I wish to appeal to my colleagues to support expeditious passage of this bill. Thank you so much for the attention, Mr. President.
Thank you, Mr. President. Distinguished colleagues, I remain Senator I.D. Gyang. I'm from Plateau North. Mr. President, distinguished colleagues, I stand to contribute to this important bill that seeks to repeal the Quarantine Act, laws of the Federation of 2004, and enact the National Health Emergency Act to make provisions for regulating and preventing the introduction into and spread in Nigeria of dangerous infectious disease and for other related matters. Distinguished colleagues, I would want to limit my contribution to the exercisable powers under the bill, particularly as it relates to the rights of citizens to liberty and privacy. I have taken a look at the bill, and the powers that are exercisable by Mr. President and governors, to the extent that the private property can be taken over permanently or temporarily for the purpose of quarantining persons that are affected by contagious diseases. My recommendation would be that such powers be circumscribed. The other issue is about the the omnibus and discretionary powers that are vested in the DG of the NCDC. And these powers that are of unrestricted access, an example is the unrestricted access to and conversion of private property and premises for quarantine purposes, is another aspect that we need to take a look at. I want to refer that the bill does not contradict the Constitution of the Federal Republic of Nigeria. In Section 35(1) of our Constitution, 1999 as amended, it says, every person shall be entitled to his personal liberty, and no person shall be deprived of such liberty, save in the following cases, and in accordance with the procedure permitted by law. Subsection 1D provides the proviso under which such rights can be affected. And it says, let me take 1D. In the case of persons, sorry, let me take it again. Subsection 35, 1E. In the case of persons suffering from infectious and contagious diseases, persons of unsound minds, persons addicted to drugs or alcohol or vagrants, for the purpose of their care or treatment, for the protection of the community. So the Constitution has allowed a situation where the rights of citizens to their liberty can be affected, and the proviso is to the extent where a person is suffering from infectious or contagious diseases, and which is what this bill has addressed. And given the fact that it does not contradict the Constitution, the only aspect will be for the powers exercisable, particularly by Mr. President.
Distinguished, you may round up, please.
For the powers to be circumscribed. And again, the powers of the DG should not be such that are omnibus and discretionary. So that should be taken care of when they are at the committee stage. But the bill does not contradict the Constitution of the Federal Republic of Nigeria. Thank you.
President, I represent Kano North. Mr. President, we live in a changing world. A world that changes every day. And we face different challenges from time to time. Therefore, Mr. President, it is apt and appropriate to bring forward this bill, which is seeking to amend the Quarantine Act of 1926 in order to bring in the realities of our time in terms of the challenges we face, particularly the current diseases that affect us from time to time. The fact remains that when the Quarantine Act of 1926 was enacted, nobody thought that we'll find ourselves in facing the problems we are facing now in terms of different diseases that are affecting facing people globally. Mr. President, it is therefore necessary that we amend this act, we repeal it, and then enact the one that is being sought by this bill, so that we strengthen our quarantine system in order to protect our people and to protect our country. The intent of this bill is straightforward. It is to make sure that we bring our quarantine laws up to date in order to face the current realities that are confronting us, that are keeping our people that are really affecting our people, and people are dying of different diseases. We had Ebola some few years back, and it's coming up again. Currently, we are being faced with COVID-19, and we don't know what will happen tomorrow. So it is always necessary that you create laws to deal with the current realities that you find yourself, and also be futuristic, so that whatever happens, you have laws that can actually take care of what is going to happen in the future. So I commend the sponsor of this bill for bringing forward this bill in order to deal with the current realities that we find ourselves, particularly now that we are being confronted with COVID-19 pandemic and also the resurgence of Ebola. We don't know what will happen tomorrow, as I said earlier, so it's therefore apt.
Is there any, those in favor that this bill be now read a second time, say aye. Those against, say nay. The ayes have it. Clerk of the Senate.
Diseases and for other related matters, 2021, SB 413, first reading.
A bill for an act to repeal the Quarantine Act Cap Q2 laws of the Federation of Nigeria 2004 and enact the National Health Emergency Act to make provisions for regulating and preventing the introduction into and spread in Nigeria of dangerous infectious diseases and for other related matters. 2021 second reading taken, and the bill is referred to the Committee on Health to report back within 4 weeks. Leader of the Senate.